Welcome to Udo TV. Today we're diving deep into developing your personal health plan, specifically looking at diet and nutrition for liver and heart health and rehabilitation too.
Yeah, it's a really important topic.
It really is. This deep dive, it's all about how our daily choices, especially what we eat, how we nourish ourselves, are just absolutely central to keeping two of our body's powerhouses, the liver and the heart, healthy,
Mhm.
and even helping them recover if things go wrong.
That's right. And what's truly fascinating, I think, is the incredible interconnectedness. How these systems work together.
Mhm.
Our everyday decisions, they can have these profound long-term impacts. It's not just about preventing disease, but also really supporting genuine recovery.
It really highlights how much control we actually have, doesn't it, over our own well-being.
It does. It really empowers you.
Okay, let's unpack this a bit. Maybe start with liver health, because the liver, it's just an incredible multitasker, isn't it?
Oh, absolutely. It's doing so much. Producing vital proteins, cholesterol, bile, storing essential vitamins, minerals, carbohydrates.
And the big one, detoxification.
Exactly. Crucially, it's our body's primary detox system. It breaks down toxins like alcohol, medications, even the byproducts of our own metabolism.
So keeping it in good shape is, well, it's pretty much non-negotiable for overall health then.
It really is. And the good news, thankfully, is that certain foods can be incredibly beneficial. Really give it the support it needs.
Okay, like what should we be looking for?
Well, for beverages, coffee is actually a standout. Might be surprising to some.
Coffee.
Yeah. Studies show it seems to lower the risk of cirrhosis, which is serious liver scarring, and even a common type of liver cancer.
Wow.
And it also seems to boost an important antioxidant called glutathione. This helps protect your liver cells from damage.
Interesting. What about tea? I hear a lot about green tea.
Green tea also shows promise. Research suggests it might help reduce liver enzyme levels in people with non-alcoholic fatty liver disease,
Oh.
NAFLD, and it's also linked to potentially lower liver cancer risk.
Hmm.
Though, a small note of caution, maybe with highly concentrated green tea extracts, stick to the brewed tea for the general benefits.
Good tip. So it sounds like antioxidants are like a really big deal for the liver.
They really are. They combat oxidative stress, which is a key factor in liver damage.
So beyond drinks, what other foods pack that antioxidant punch for the liver?
Think vibrant, colorful fruits. Grapefruit is a great example. Contains antioxidants, specifically naringin and narragin.
Right.
These help reduce inflammation and protect liver cells. There's even some research suggesting they might reduce hepatic fibrosis, which is the buildup of scar tissue.
Okay. And berries. I always hear berries are good.
Yes, blueberries and cranberries are fantastic. They contain anthocyanins. Those are the pigments that give them their rich color.
Hmm.
And these are linked to improvements in fatty liver, especially in NFLD studies. Grapes, too, particularly the red and purple ones, seem to help lower inflammation and boost antioxidants.
It's amazing how specific foods can have such targeted effects. What else? Any vegetables stand out?
Definitely. Cruciferous vegetables. So we're talking broccoli, Brussels sprouts, cauliflower, kale.
The ones people either love or hate.
Kind of, yeah. But they contain these unique compounds like glucosinolates that seem to actually alter the liver's detoxification processes in a beneficial way, sort of supercharging it.
Okay, so load up on the broccoli sprouts. What about things like nuts or fish?
Good question. Nuts are great, rich in healthy fats, antioxidants, vitamin E. They're associated with a reduced risk of NAFA. And fatty fish like salmon, mackerel, sardines.
The omega-3 powerhouses?
Exactly. Those omega-3 fatty acids are brilliant at reducing inflammation system-wide, including in the liver. They can help lower liver fat and triglycerides in people with NAFLD.
And olive oil. That's always mentioned in healthy diets.
Absolutely, especially extra virgin olive oil. It's a cornerstone of the Mediterranean diet, which we'll probably talk more about. It's linked to reduced liver fat accumulation and improved liver enzyme levels.
So if we zoom out a bit, what are the sort of broader dietary principles for keeping your liver happy?
Well, it really boils down to building your diet around whole, nutrient-dense foods. Think high in antioxidants, high in fiber.
Lots of plants.
Definitely. Aiming for a largely plant-based approach is a great strategy. Maybe, 90% plant-based if you can manage it. Lots of vegetables, fruits, whole grains, nuts, seeds, legumes.
What does that naturally push out?
Well, it naturally limits things like red meat, maybe eggs and chicken too, depending on how strict you are. And crucially, it helps you avoid or seriously cut down on the stuff that burdens the liver processed foods: sugary drinks, refined grains, and those unhealthy saturated and trans fats.
Right. Basically give the liver less junk to deal with.
Precisely. Give it the good stuff, the fuel it needs to perform its, hundreds of jobs effectively.
And what about just water? Seems basic, but is it important?
Oh, absolutely critical, often overlooked.
Mm.
Hydration is key for the liver. Water helps dissolve fats and soluble fiber. It helps prevent constipation, which reduces the burden on the liver indirectly. It also thins the blood slightly, making it easier for the liver to filter. And of course, it helps flush out the toxins that the liver has processed.
Don't underestimate H2O then.
Never.
You're listening to Udo TV.
Okay, so that's a good look at the liver. Shall we shift gears to the heart?
Let's do it. When we talk about heart recovery, cardiac rehabilitation often comes up. What exactly is that? It sounds kind of intense.
It can sound that way, but think of it more like having your own personal coach and cheerleader for your heart health.
Okay, I like that analogy.
It's a medically supervised program, usually for people recovering from things like a heart attack, heart surgery, angioplasty, or even heart failure.
So what does it actually involve? What happens in cardiac rehab?
It's quite comprehensive, actually. It usually offers one-on-one supervised exercise sessions tailored to your specific condition and fitness level.
Right, so it's safe.
Very safe, yeah. Plus, you get practical advice on heart-healthy eating, connecting back to what we just discussed. There's often support for stress reduction, which is huge for heart health, and help with managing medications, too.
It sounds really holistic, more than just exercise.
Exactly. It addresses the whole picture.
And the benefits, are they significant?
Oh, they're profound, truly.
Huh?
Participants generally report feeling better, both physically and emotionally. They regain strength and stamina. But the big thing is, it significantly reduces the risk of future cardiac events.
Really? Like how much?
Well, studies have shown that people who complete cardiac rehab can have up to 30% fewer fatal heart events compared to those who just get standard therapy alone. And they might be about 25% less likely to die overall.
Wow, those are serious numbers.
They really are. It also helps manage symptoms like chest pain, can aid in weight loss, and just generally improves your nutrition and lifestyle habits.
That's incredibly valuable. And I guess the physical activity part ties back to liver health, too.
Absolutely. It's all connected. That physical activity is crucial for both. We're generally talking about moderate aerobic activity. The recommendation is usually at least 2.5 hours per week.
What does moderate look like?
Things like brisk walking, swimming, cycling at a comfortable pace. You want to get your heart rate up a bit, but still be able to, hold a conversation.
Okay.
And you can break it up. Aim for maybe 3 to 5 days a week. Do at least 10 minutes at a time. Consistency is key.
And how does that movement help both organs?
Well, for the liver, physical activity is proven to help decrease liver fat. That's huge for conditions like NAFL. For the heart, it strengthens the heart muscle itself, improves circulation, helps lower blood pressure and cholesterol.
Plus the other benefits, right?
Oh, yeah. Better sleep definitely helps manage stress.
Yeah.
It's just fundamental for overall well-being.
So diet-wise for the heart, we hear a lot about plant-based diets again.
Yes, very much so. Organizations like the American Heart Association strongly recommend plant-based eating patterns for cardiovascular health.
What does that look like specifically for the heart?
Similar to the liver, really. Rich in those dark leafy greens, colorful fruits and vegetables, whole grains, think oats, quinoa, brown rice, and plant-based proteins.
Like beans, lentils.
Exactly. Beans, lentils, chickpeas, nuts, seeds. These diets are proven to lower the risk of cardiovascular disease. They help improve the function of your blood vessels, make them more flexible.
And it's the fiber and fats again?
Yep. They offer loads of soluble fiber, which is great for helping lower LDL, the bad cholesterol. And they provide healthy, unsaturated fats, particularly from things like nuts, seeds, avocados, and olive oil, which are much better for your heart than saturated and trans fats.
It really seems like the dietary advice for both liver and heart health overlaps quite a lot.
It really does. What's good for one is generally good for the other. Which brings us to a really crucial point, especially regarding fatty liver disease.
Okay, what's that?
Well, it's vital to highlight that currently there aren't really any medications that directly target lowering the fat in the liver itself for conditions like NAFLD.
No magic pill, then?
Not for the fat itself, no. There are meds for associated conditions like diabetes or high cholesterol, but not directly for the liver fat. This means that lifestyle interventions, diet, and exercise, they aren't just an option. They are the main therapeutic approach.
That's a huge takeaway. So lifestyle changes are basically the primary treatment.
For reducing liver fat, yes.
Yeah.
And the great thing is, these interventions, especially adopting dietary patterns like the Mediterranean diet we mentioned.
Right, the olive oil, fish, veggies.
Exactly. That whole pattern, whole grains, olive oil, fruits, vegetables, fish, nuts, legumes, low in added sugars and processed meats, it's been shown to potentially prevent, stop, and in some cases even reverse the accumulation of fat in the liver.
Reverse it. That's powerful.
It is. And the synergy is incredible because that same Mediterranean diet pattern also benefits all those related conditions:
Yeah.
obesity, type 2 diabetes, metabolic syndrome, and cardiovascular disease.
So you're tackling multiple issues with the same lifestyle approach.
Precisely. It's a win-win-win.
So these consistent changes in diet and exercise, they're not just temporary fixes, are they?
Not at all. It needs to be viewed as a sustainable lifestyle shift for profound long-term health improvements. And of course, a major benefit that helps both organs is weight loss, if needed. Losing excess weight is often crucial for both liver and heart health.
Right, reducing the overall load on the body.
Exactly.
So, wrapping this up, it seems the impact of making intentional choices about diet and lifestyle is just massive.
It truly is. Integrating these nutrient-dense foods, getting consistent physical activity, it acts as this powerful natural defense system for your body. And it's a restorative force, too, helping your liver and heart to heal and function optimally.
It's quite empowering when you think about it that way.
Definitely.
So, what does this all mean for you listening right now? I guess it means taking an active role, a conscious role in your health through those everyday choices. What you choose to eat, how you decide to move your body, even how you manage stress focusing on these things can truly be your most effective. And importantly, your most natural path to lifelong vitality. It's within your reach.